everyone. My name is Olushola Oladele. I'm a DMP student at UMass Global. This is a psychopharmacology case presentation on the medication chosen, Trazodone. Trazodone, an antidepressant drug approved by the FDA for treating major depressive disorders and symptoms associated with depression, is chosen for this medical case presentation. This drug is used alongside other drugs or psychotherapies for treating depression. Beyond its antidepressant activity, the drug is used off-label for insomnia, anxiety, substance abuse, post-traumatic stress, and bulimia because of its serotonergic receptor antagonism and serotonin reuptake inhibiting effects. It is used for PTSD when the first-line treatment using SSRIs does not show efficacy. Trazodone is not FDA approved as sedation for individuals with sleep disorders due to insufficient clinical data to justify its use as a sleep aid. Patient M is a 55-year-old patient who presented with the following symptoms: anxiety, sleep disturbance, fatigue, agitation, poor appetite, weight loss, and poor concentration. This patient has language skills that is intact and has a normal heart rate, but the physical symptoms indicate that the patient is in a depressed mood, and this patient has attempted to commit suicide in the past at least 3 times and was diagnosed with major depressive disorder in 2021. During the interview with patient M, she indicates that her husband died of pancreatic cancer 6 months ago, and she's here to come to terms with the loss and is depressed. Patient M has one grown-up child who resides in another state and who rarely visits her. Patient M lives alone. She does not have friends in the neighborhood. Some of her past medical history was retrieved from the EHR. This information is highly reliable. Patient M has sleep disturbance, nervousness for the past 3 weeks, and she has loss of appetite, and she's also losing weight. Patient M started to experience sleep disturbance and poor appetite 3 weeks ago. She resorted to vitamins to help boost her appetite, but it did not show any efficacy. In the past, she has been diagnosed with recurrent depression, and she suspects to have the same condition at this time. The use of Ambien has not helped address her sleep problems. She does not use any other medication. However, she has been admitted in the hospital in the past for suicidal behaviors, and she was also treated for depression in the past. Patient M has also been using tobacco products for the last 20 years. She went for a psychiatric treatment in 2019 and depression treatment in 2020. She does not have any recorded allergies. Patient M was brought up in a family with domestic violence, which forced her parents to separate while she was 9 years old. The patient has a history of being bullied for being overweight in high school, and this has actually influenced her sense of worth and ability to make friends. Patient M scores poorly in social skills and making friends. A mental health assessment is an asset, while poor friends who do not support her mental health are liabilities. Physical examination shows that patient M suffers from lack of appetite, poor concentration, and fatigue. The differential diagnosis is anxiety, which causes her to experience sleep disturbances and loss of appetite. Patient M diagnosis indicate that the patient suffers from depression, and a physical assessment indicate that she has anxiety. The condition DSM code is 296.36. That's a recurrent major depressive disorder, and the ICD code is F32.9. The evidence-based non-pharmacological intervention for patients would be to take the extract of Rhodiola roseo, adaptogenic plant that has been reported to have therapeutic effects in clinical trials in alleviating stress and relieving depression symptoms. Rhodiola roseo product has been used in Asia and Eastern Europe as a natural remedy for fatigue. Patient M will be taught to adhere to the recommended dosage for positive health outcomes. Moreover, the patient will be taught the significance of having social network as a useful non-pharmacological approach to prevent depression. Patient's M child will also be taught about the value of keeping in touch with her mother to prevent her from developing depression. Trazodone is the most appropriate medication to use with patient M as she has been diagnosed with recurrent major depressive disorder. The precise, the precise diagnosis of major depressive disorder is vital before recommending trazodone to patient. Patient M has a history of recurrent major depressive disorder and she presents symptoms for depression, which could be best treated with trazodone as an antidepressant drug for treating depression and associated symptoms. The second case study is a case study for patient N. Patient N manifests the following symptoms: fatigue, sweating, appetite loss, and irritability. She is a 46-year-old African American Muslim woman, a mother of two grown up children who lives and does not come home regularly. Patient N was diagnosed with anxiety and depression disorder in 2020. Physical observation indicated that patient N has normal heart rate and presents signs of anxiety. Patient N does not have any friends. Her health record was updated 2 weeks ago, therefore the patient's information is very current. She experiences poor appetite and insufficient sleep because of several nights of sleeplessness. Patient N began experiencing sleeplessness 3 months ago and skips meals because of poor appetite. She does not take any medication at this time and is not receiving any psychiatric treatment at this time. In 2020, she was treated with benzodiazepine and does not have any drug or substance use addiction. Patient N has not had any key treatment apart from lobotomy in 2019. She does not have allergies. With respect to family history, patient N's elder son was diagnosed with major depressive disorder. As for the developmental and social history, the patient was brought up in a healthy family environment. However, when in high school, she suffered from anxiety. A social assessment indicated that she is less skilled in making social connection. Assets are mental health assessment, while liabilities are on supportive friends to her mental health. The physical examination revealed that the patient has had sleepless nights and suffers from poor appetite. Diagnosis that patient M suffers from is anxiety. And the results of a psych assessment indicates that besides anxiety, she's also depressed. Anxiety's ICD-10 code is F419. I'm sorry. Anxiety's ICD code is F41.9 and DSM code is 300.01. Benzodiazepine treatment is recommended for patient N. Progressive muscle relaxation will also be recommended for patients because research evidence shows its effectiveness in managing anxiety by making patients feel calm. The contraction and relaxation of muscles is said to regulate emotional and physiological reactions to stressful events, making patients feel calmer. Moreover, patients' education to identify factors that triggers a current mental health state will be done to avoid those factors that might worsen our condition. Trazodone is not appropriate to use with patient N because its use for anxiety is off-label, which means FDA has not approved them because of lack of sufficient clinical data to justify its use. Based on the symptoms manifested by patient M and patient N, are consistent with those of patients suffering from major depressive disorder and anxiety. Thus, the diagnosis for patient M is depression and anxiety for patient N. Trazodone as an FDA-approved antidepressant alongside non-pharmacologic interventions will improve medical outcomes for patient M. However, trazodone is inappropriate for patient N because its use for anxiety is not approved by FDA. Diversity factors influence the decision making with these two patients, given both are female American Muslims. Due to their religious values and beliefs, the two patients said that they preferred their physical examination be performed by a female healthcare practitioner. Moreover, the patients felt comfortable making their decisions in the presence of a female nurse. Necessary adaptations were considered to include interest of these two patients. Research has demonstrated that trazodone is one of the most effective FDA-approved antidepressants recommended for patients diagnosed with major depressive disorder. In patient M, the death of her husband and her lonely life contributed to her depression. Trazodone could be effective when used alongside the extract of rhodiola roseo, adaptogenic plant that has been reported to have therapeutic effects in alleviating depression symptoms. in clinical trials. Thank you for listening to my presentation.